A healthy diet, we know, is a key part of a healthy lifestyle. And with that in mind, South Asian cuisine is getting a makeover. This is going on in British Columbia's Lower Mainland, where South Asians are looking at their higher rates of heart disease and diabetes and doing something about it. As Tina Lovegreen shows us, some local temples are actually reviving and revising their recipes.
This popular dish, known as dal, is high in protein. But before the health authority got involved, 4 pounds of oil was used to cook it, whereas now they're down to 1 pound.
He said, normally you would see the oil floating on top when they're making this dish, but he goes, now you can barely see that there's any oil.
The new dietary program targets South Asians because research shows chronic diseases for the ethnic group is on the rise.
South Asians are 2 to 3 times more prone to get diabetes, 2 to 3 times more prone to get heart disease. And so part of it is genetics, but there's also a lot to do with health behaviors.
Reducing sugar was a high priority. This is sweet rice. It's made of rice, and you guessed it, sugar.
Before they used to put in 32 pounds of rice, they used to add 25 pounds of sugar. And so now that since they started working with the CBC Health program, they are now put in 32 pounds, they're now adding 14 pounds of sugar.
Even chai, a staple with Indian meals, isn't as sweet as before. Sugar has been cut down 25%, and the full-fat milk swapped out for reduced fat. But why was so much sugar and fat being used in the first place?
People were just used to high sugary food, but didn't understand the repercussions of that. People didn't have the knowledge as to what the effects, the downstream effects of that would be.
Gurdwaras were an easy place to start educating the community because so many people come here to share a meal. This one serves up to 500 people on a daily basis and does so 7 days a week, 3 times a day. And those eating the food say they don't mind the more health-conscious recipes.
So it's good, always.
Equally as tasty as it was before.
But some visitors to the temple think there's still more work to be done.
Instead of using sugar, you can use honey, so that's one suggestion he recommends.
The healthier recipes have been rolled out at 7 temples under the Fraser Health Authority, with the hope of creating a healthier future for the South Asian community. Tina Lovegreen, CBC News, Surrey.